Welcome to our video about skin antifungal treatment. Whether you suffer from ringworm or other fungal infections, there is a solution. Antifungal cream is readily available in the market and works by preventing fungus from growing. You can buy different kinds of these creams, including 2-in-1 creams, which contain both antifungals and anti-inflammatory drugs, such as hydrocortisone. However, it is important to note that some antifungals can cause side effects, so it is essential to consult your doctor before taking any medications. Imidazole derivatives. Imidazole derivatives are a class of antibiotics, and their antifungal properties are broad. Most of these drugs inhibit the growth of dermatophytes by impairing the activity of enzyme systems bound to membranes. They also inhibit the synthesis of ergosterol and deplete intracellular phospholipids. Other imidazole derivatives inhibit the growth of fungi by impairing ergosterol biosynthesis and reducing cellular permeability. In addition to being effective against fungi, imidazole derivatives are also widely used as neuroprotective drugs. One imidazole derivative, fexinidazole, is an oral drug, and it has two metabolites. When taken in combination with mil, fexinidazole exhibited significant anti-leishmanial activity. Two other imidazole derivatives are PA 824 and delamanid, which are approved as antitubercular medications, but which have demonstrated a potent inhibitory effect on L-donovani. The imidazole derivatives were synthesized using 3 distinct steps. The compounds were tested in vitro and were found to exhibit increased antifungal activity. Among the derivatives, compounds 31 and 42 showed potent inhibitory effects on both C. albicans and dermatophytes. However, thiabendazole has been replaced by imidazole derivatives. Benzimidazole and ketoconazole derivatives are poorly soluble in water. In addition to being poorly soluble, they have poor solubility in other organic solvents. These compounds are best soluble in chloroform and propylene glycol. Some imidazole derivatives are insoluble in ethers. However, they are more bioavailable and are used as topical creams in skincare. Miconazole and imidazole derivatives are widely used for the treatment of fungal infections. Despite being a relatively common antibiotic, fungal infections can become dangerous if an immunocompromised patient has an impaired immune system. The potential for developing drug resistance will only increase as fungal populations continue to increase, and the need for antifungal medications will only grow. Miconazole derivatives have been used extensively in medicine for over 40 years, and new formulations have shown promising results in phase 2/3 trials. Miconazole laureatar has received FDA approval in Europe and is pending approval for use in the US. Topical steroids. When choosing topical steroids for skin antifungal treatment, consider the potency of the medication. The type of infection being treated, as well as the duration of the treatment, will affect the potency of the steroid. Listed below are the side effects of topical steroids. The full list can be found in the medicine leaflet. The first 2 days of application may cause irritation and sting. However, these effects usually clear up after 2 days. You may also experience thinning of the skin or hair growth on the site of application. Generally, the side effects of topical steroids are minor and temporary. If you're worried about the side effects of topical steroids, you can choose the steroid with anti-infectives. These creams contain a steroid and an anti-infective agent. Together, they work to fight infections on the skin and scalp. Topical steroids reduce inflammation, suppress the immune system, and constrict blood vessels. Anti-infectives work to kill bacteria, fungus, and viruses that cause skin infections. Corticosteroid therapy may also be beneficial for certain infections. Corticosteroids have anti-inflammatory properties, which may help improve compliance with treatment and reduce the risk of bacterial superinfection. However, improper use of antifungal corticosteroid combinations may lead to treatment failure or adverse effects. A good approach to topical steroids for skin antifungal treatment is a collaborative effort that involves all stakeholders, including physicians, pharmacists, and patients. As with any medication, there is a range of side effects when using topical steroids for skin antifungal treatment. The most common side effects of topical steroids include irritancy, a decrease in barrier function, allergies, and occlusion. When used in excess, excessive use of topical steroids may cause eye and kidney complications. Although topical steroids are generally safe, Their use should be limited to short-term relief of symptoms. Topical antifungals. Topical antifungal treatment for skin is a medication that is applied to the affected area and kills the fungi on it. Topical antifungals are available in various forms. They come as a lotion, cream, gel, or spray. The antifungal medication works by inhibiting the fungi from producing ergosterol, a fundamental component of the fungal cell membrane. These medicines are available in a variety of strengths and are effective for a variety of skin problems. As fungi thrive in warm and moist environments, patients are advised to wear loose-fitting garments and socks with wicking properties. Patients should also avoid walking barefoot or sharing clothing with others. There are also several topical antifungal treatment options, such as Whitfield's ointment and Castellani solution. However, their efficacy has not been quantified. Some people experience a flare-up in the condition, and topical antifungal medications may help to relieve the symptoms. However, the best option for treating tinea versicolor is to consult a physician. Treatment with a topical antifungal agent is effective in most cases, but if the condition recurs, it is advisable to take systemic antifungals. Topical antifungal agents are not always effective for the treatment of onychomycosis, which cannot be treated using topical antifungals. However, topical antifungal agents can have adverse side effects and can cause a range of reactions. Side effects may include itching, burning, blistering, or bleeding. Some patients may also develop an allergic reaction, resulting in peeling or blistering skin. Generally, antifungals are effective for treating most cutaneous fungal infections, but there are some contraindications to them. The risk of allergic reactions increases as the fungus becomes resistant to antifungal medicine. Ringworm. Ringworm skin antifungal treatment comes in several forms, including OTC creams, ointments, and pills. Prescription antifungal drugs are often used to treat ringworm. Some of these medications, such as terbinafine and clotrimazole, are taken by mouth for 1 to 3 months. Some of these drugs can be harmful to a woman's unborn child, so doctors do not recommend them during pregnancy. Most cases of ringworm clear up on their own within 2 to 4 weeks, but more severe cases may require treatment for several months. The infection may spread to the scalp, facial hair, and nails, so treating it right away is critical to reducing your risk of spreading the fungus. However, if you notice a rash on your face or other body parts, it is best to visit a dermatologist or urgent care center for diagnosis. Healthcare professionals will examine the area and confirm whether you have a ringworm infection. They can prescribe a stronger medication, as well. Infection with ringworm is transmitted through contact with infected soil. The infection can spread from person to person, but it is most likely to spread through prolonged contact with an infected object. There are certain conditions that increase your risk of contracting ringworm, including people with warm climates or a weakened immune system. People who live in warm climates and frequent public restrooms are at increased risk of contracting the disease. Ringworm is often accompanied by sores and bald patches, and people who play contact sports or wear tight clothing are also at risk. While ringworm is typically diagnosed on the basis of a patient's medical history and a physical examination, a doctor can order further tests to determine whether the infection is a fungus. Some cases of ringworm do not require further testing. Some may be treated with over-the-counter creams, but others require prescription medicine from a dermatologist. If you suspect that you have ringworm, see your healthcare provider right away. Tinea versicolor. If you have been diagnosed with tinea versicolor, you'll likely be given a prescription for a skin antifungal treatment. These treatments may involve using an antifungal cream or lotion, or you may even try a shampoo. While you may be relieved that the infection is gone, you'll probably notice that the rash looks uneven for a few months after the treatment. Depending on your individual situation, the infection may recur, so treatment is important to prevent it from reoccurring. A doctor may perform a potassium hydroxide scraping to make a proper diagnosis. The fungi that cause tinea versicolor look like meatballs or spaghetti. The doctor may also stretch the affected area to see if more scale forms. This evoked scale sign is helpful in distinguishing tinea versicolor from other similar appearing skin conditions. However, if the skin examination is not revealing any significant fungi, a biopsy may be necessary. To treat the infection, a dermatologist may prescribe a topical antifungal treatment for tinea versicolor. Antifungal medicines are generally effective in controlling the infection and include ketoconazole, selenium sulfide, and pyrithione zinc. Depending on the severity, location of the infection, antifungal medicines may be necessary as the fungus usually returns when exposed to warm and humid environments. In addition, a medicated cleanser can prevent the overgrowth of yeast on the skin. Patients with tinea versicolor often experience patches on the trunk, face, or shoulders. Symptoms vary from person to person. Some have light brown or white patches, while others have dark or gray-black ones. This infection is most common on the body, but it can also appear on the face and abdomen. If the infection is left untreated, it can spread to other areas of the body, including the eyelids. Thank you for watching. Please like, comment, and subscribe if this was helpful.